If you're struggling with insomnia, you're not alone. Today, I wanted to share with you the tips and tricks that I've learned from taking care of thousands of patients with insomnia. The first thing I want to do is dispel this myth that most people sleep well every night. The second thing I want to talk about is fostering a framework to work with when we're facing a bad night's rest. We all know that you can't force sleep or that you can't demand sleep, but I've identified 3 mantras when you're facing a bad night's rest that can be super helpful. The first is, rather than focusing on sleep, focus on being comfortable and resting. The second, rather than focusing on the outcome of sleep, focusing on being grateful if sleep happens. I'm not going to demand it, but I'm going to be grateful if it happens. And then the third mantra is accepting that if I don't sleep well tonight, I will survive. We'll figure out a solution. Once we dispel the myth that everybody needs to sleep well most of the time or all of the time, and that there's 3 mantras or ideas that we can keep in our minds when we're facing a bad night, we're already halfway there. I like to think about the problems that cause insomnia separating into 3 categories. The first one is lifestyle and sleep hygiene. The second one is medical problems. And then the third one is mental health. So let's go through each of those one by one, and then we'll come back after that. So lifestyle, this is sort of an obvious one, but I think patients and myself at times have underestimated how much this influences our sleep. Caffeine after 9 or 10 o'clock in the morning, not having a quiet, cold, and dark room at night, having a stressful conversation in the evenings, lots of light or sounds before bedtime. These things significantly affect our chances of waking up at night and sleeping in general. So if you're facing sleeping problems and you go through this inventory and there's some problems, that's definitely the first place to start. The second category of problems is medical situations or medical things that can cause insomnia. So there's snoring and sleep apnea, there's waking up to go to the bathroom, dry mouth, pressure points and pain issues. This is one of the main reasons that patients come to see their doctor, to focus on trying to improve some of those things one by one. It takes a lot of time and effort to go through each of those, but it's super important in the assessment of somebody facing insomnia. And then the third category is mental health and neurochemical balance. One thing I like to do is to take a step back and try to remind my patients that the human brain evolved in a very different environment than we are now. We are constantly bombarded by stimulation, messages, noises. We have a lot of pressure, a lot of responsibilities. Keep in mind that when our sympathetic nervous system is constantly stimulated, it makes it really hard to sleep. Depression can result in a cortisol spike early in the morning. This mental health component of the insomnia assessment can be really challenging to fix, but it's very valuable in going through this with patients and yourself to try to help the problem. Once we go through each of these 3 categories, we try to list the problems in each of those categories one by one and determine if there's any solutions. And I think with each of these components, a good question to ask yourself is, what would it take for me to be able to sleep well? It may mean that a job switch is indicated, or it may mean that you need to proceed with a thorough medical evaluation of a problem and really put the energy and take all the steps necessary to get that fixed. It may be making some big changes with your daily schedule to try to fix that lifestyle component. Ultimately, if you're having sleep problems, you need to also remind yourself and ask yourself that this is a really important kind of like basic function of living. And so if you're not sleeping well on a consistent basis, then, we might need to sort of work our life around that, as opposed to trying to make ourselves sleep by, medications or other interventions that are more drastic. So again, asking ourselves, what would it take for these things to change so that I could sleep, is a really good place to start. The good news is that even if you can't fix everything, if you can isolate some of these problems and fix a few of them along the way, while you may not necessarily get perfect sleep, your sleep should start to improve over time. But if you are somebody who has insomnia and you've kind of gone through each of these categories and you've optimized whatever is feasible or possible for you to do, then we can talk about medications for sleep. But again, it's sort of like the last resort. Hopefully this video was helpful for you. The main thing I want to convey is that it's normal to have sleep problems. A lot of it can be fixed by addressing your frame of mind when you're having a bad night's rest. Pick a couple of things in each of those categories to fix, and seeing how it goes over time is a really good strategy to help your insomnia problems in the long run. I'm going to keep trying to make videos like this with clinical pearls and clinical insights that I've learned taking care of patients over the years. So look out for more videos. Thank you so much.